All right. I was just shoveling snow and I saw this come through in my feed. So I put my shovel down, took my hat off, and I was like, I got to make a video about this. Change.org. There is now a petition, urgent call for U.S. children to have access to an FDA-approved low-dose atropine. This has been going around in the myopia management community. It's got 205 signatures. And I want to make a case for why you should sign this. If you're an optometrist, if you're an ophthalmologist, if this resonates with you, if the subject matter resonates with you, please go check this out. If you vibe with this, please sign it. And here's why. I have been a part of the myopia management industry for almost my entire life. I grew up working in my parents' myopia practice. They did orthokeratology. I was the executive director of the American Academy of Orthokeratology and Myopia Control for like 15 years. I have worked very closely with optometrists who are either doing myopia management or want to do myopia management. I have a passion for it. And the reason why is that it changes kids' lives. And what do I mean by that? Well, if you go to this petition, you can see right here where it says, pediatric progressive myopia is rising at an alarming rate across the United States. As myopia worsens, the lifetime risks of retinal detachment, myopic maculopathy, glaucoma, and permanent visual impairment increases substantially. This is stuff we all know. The World Health Organization has predicted that by the year 2050, half of the world's population will be nearsighted. This is something we all know. This is information that gets repeated over and over and over again. If you're an eye care provider, I bet you've heard this multiple times. And yet, it just doesn't seem to move the needle enough. In my opinion, our biggest problem in myopia management is not enough ECPs are doing it. And I'm not one of these people that says all optometrists should be doing myopia management. I don't believe that. If you are not interested in doing myopia management, or if you can't do it, I'm not going to throw shade at you. I don't think every optometrist, for instance, should do myopia management. I think if you're interested in it, if you have a passion for it, if it's something that you want to address, I think that you should check it out. The problem still remains that we don't have enough ECPs doing myopia management. We don't have enough ECPs addressing the pediatric progressive myopia and the risks, the disorders and diseases associated with it. Why is that? The reason why is that a lot of myopia management has several barriers to entry that the modern optometrist specifically and other eye care providers just can't meet for whatever reason. And that's why I don't throw shade at any optometrist that says, I don't want to do myopia management. I get it. There is a barrier to entry in education, cost, investment, time, staff training, and accessibility as far as like, is the modern optometrist able to rewrite how they practice and restructure how their office works in order to accommodate the amount of time needed to spend with a myopia management patient? There are solutions to all these things, but all of this gets in the way of the modern ECP trying to just do right by their patients. Here's another one. We don't have an FDA-approved source of low-dose atropine. Why is that significant? Well, atropine has all sorts of X factors associated with it from my perspective. I'm not an optometrist. I'm not an ophthalmologist. From my perspective, there's issues that ECPs would rather not touch with atropine when it comes to consistency, how it's stored, formulated, its quality, how long it's been on the shelf, all of the things. An FDA-approved low-dose atropine essentially could solve the problems. What it could do is it could take all of these ECPs who are, for whatever reason, sitting on the sidelines and empower them to start being a part of the solution. Is atropine going to solve all of myopia's problems? No. But It's better than doing nothing, and it's going to start the process. It's going to expand the category. It's going to treat a lot more kids who desperately need that help. And having an FDA-approved option is potentially the solution to that. The European and UK equivalents of the FDA have already approved a low-dose atropine. It's getting accepted the world over. Why we're sitting this out in America is a huge question mark to me, especially when, if you do anecdotal research, and they bring it up in this petition, there's the STAR study. You can look this up for yourself. The STAR study involved like 800 and something patients. It had several benchmarks that needed to be met, and those benchmarks were met. The science is sound. The proof is out there. Why the FDA has not approved low-dose atropine in the United States is exceptionally frustrating for someone like me, because I have watched myopia treatment change children's lives. And I'm not just talking about the risks of retinal detachment or glaucoma or not being able to see the board or the problems with a kid wearing thick glasses and what that does to their, emerging personalities. I have watched kids who suffered from high prescriptions basically turn into shells of what they could potentially be. They're subdued. They're don't engage with the world as much. I've seen this happen. I've seen what happens when you take a kid who is suffering and needs myopia treatment and introduce something like orthokeratology, and I watch those kids expand, engage, become social. It's changed their lives. Those kids are now adults. That's how long I've been in this industry. And like I said, FDA-approved low-dose atropine is not going to solve all the myopia problems. But if we can start giving ECPs an easy button to help solve the problem, I think that's a win-win. So I'm imploring you, because the final point I'll make is that I can't sign this petition. I'm not an optometrist. I'm not an ophthalmologist. So I can't sign it. So if that's why I'm imploring you to do so. Do it for the children who desperately need as many available treatment options as we can give the practitioners who are going to try to address this problem. We need an easy button in myopia. This could potentially be it. There's no reason not to, as best as I can tell. Check it out for yourself. Go to change.org. I'll put a link in the description or wherever you found this video. And I'm asking you, please sign it for me. If not for the kids, if not for yourself, if not for your interest in myopia management or your desire to do something about this, do it for me. Be like, I signed it for you, Matt, because I can't. And that's exceptionally frustrating that I can't be a part of this part of the solution to this problem. All right, that's my spiel. Thank you so much for your consideration. I'll see you at the next one.